For some women in their childbearing years, a breast cancer diagnosis can be devastating. Here to help us understand what options are out there for survivors wanting to start a family is Dr. John Schnoor, fertility expert and co-founder of Coastal Fertility Specialists, and Lori Shaw, a breast cancer survivor and fertility patient. Thank you both for being here.
Thank you for letting us be here.
Well, Lori, when were you first diagnosed with breast cancer?
I was diagnosed when I was 35 years old, about 5 years ago.
Oh my gosh.
Yeah, it was definitely kind of young, I guess, from what other people told me.
Very young indeed. Did breast cancer run in your family?
No, it didn't. I don't have any markers or any of the signs that was actually hereditary or just happened in my life, my family at all.
So that must have come just as a complete shock.
Yes, absolutely it did.
Had you had children before your diagnosis?
No, ma'am, not at all.
So when you received that diagnosis, knowing that you wanted to start a family, what went through your mind?
Wow, the option of what I could do next. Honestly, I didn't even know that there were more options that were available to me. I thought it was more of a here and now type of thing. And if I didn't have it already put together, then I thought I was going to just miss out, honestly.
Wow. Dr. Schnoor, do you see this a lot? Do you have many patients that have faced breast cancer or other health issues that would prevent them, that would cause them to be infertile?
Yeah. And so sadly, Lori's story is a very common one, which is young women without any risk factors, without any family history, who get a shocking diagnosis that they have a cancer that needs to be addressed. The good news about that is that long-term survival rates are now greater than 90%, which means that we in the medical industry need to focus on the cost of the cure, which is the harm that could happen from chemotherapy, which for a young woman could be a decrease in her egg count and even a risk for her fertility in the future.
Right. So let's talk a bit about that, because your advice would be to freeze eggs prior to receiving any kind of treatment.
Right. Well, there are multiple options actually available. I think the first is to seek a consultation with a specialist just so you know what that impact may be on your fertility. And then sometimes we can give medications during the chemotherapy that decreases the harm to the ovary. But probably a better option would be the ability to take the eggs out of the ovary and freeze the eggs before chemotherapy, so that when a woman is a survivor and she's now ready to get pregnant, her eggs that were frozen maybe 3 and 5 years ago could be used to help give her a very good chance of pregnancy.
Lori, how long have you been cancer-free?
I've been cancer-free for a total of 4 years now.
That's wonderful.
Yes,
that's wonderful. Yes. What kind of treatment did you undergo?
I had to go through, well, I had different types of breast cancer, so they were worried that I had to go through different types of treatment. Luckily, I only had to do chemotherapy.
So I'm sorry, you said you did go through chemotherapy?
I did, yes. Luckily, it was only chemotherapy.
I see. But Dr. Schnoor, chemotherapy, that can cause infertility in your patients.
Right. So I think from a fertility doctor's perspective, it's not if your egg count will decrease because of chemotherapy, it's how much it will decrease and what will the impact be on your fertility. And the nice thing is about freezing eggs is they don't age with time, which then gives Lori all the time she needs to deal with the breast cancer diagnosis and not worry about reproduction until she's a survivor and doing well.
Yes, absolutely. So Lori, where do you stand now? So you froze your eggs and you underwent chemotherapy. You've been 4 years cancer-free. So tell us what life has been like these last 4 years.
These last 4 years, well, the last year has been kind of tough for everyone. So I definitely had to realign myself with what I needed to do and what I wanted to do going forward. So I do believe in the next couple of years, next 1 or 2 years, I am going to look at using those eggs and hopefully starting a family pretty soon.
That's wonderful. Well, it's all very exciting. And any last advice for patients who are watching this, and for women who could potentially have a cancer diagnosis, a breast cancer diagnosis, if they do know that they want to have a family, first call that they should make?
Well, I would say keep positive, realize that what matters most is survival rates in general are greater than 90%. realize there may be a cost to that cure, and we do have some options that will help lower the risk and problems.
Wonderful. And for you, Lori, any advice to other women?
Definitely stay as positive as possible. It is definitely a trying time for everyone involved, you know, the survivor as well as the family members also. But definitely keeping a good outlook, know your options that are available to you and utilize them. Most important, utilize your options.
Absolutely. Lori Shaw, Dr. Schnorr, thank you both for being here.
Thank you.
Appreciate it.
Thank you.
We're back after this.